Abortion is one of the most talked about and emotionally charged topics in both medical and political conversations. At its core, abortion refers to the process of ending a pregnancy, either through medication or a surgical procedure. The aim is to remove the embryo or fetus from the uterus, resulting in the termination of the pregnancy. Abortion has been practiced for thousands of years, and various methods have been used in different cultures throughout history. Today, however, medical advancements have made the procedure much safer and more accessible. Despite this, the topic remains controversial, especially due to the moral, ethical, and religious debates surrounding it. Despite the controversy, abortion remains a common medical procedure. In fact, it is estimated that 1 in 4 women in the United States will have an abortion by the age of 45. Globally, an estimated 73 million abortions occur each year. Reasons for seeking an abortion. The reasons for seeking an abortion are deeply personal and vary widely. Number 1. Personal choice. Some women choose abortion because they feel they are not ready to have a child, whether that's due to financial, emotional, or social reasons. Number 2. Health risks. In some cases, continuing the pregnancy poses significant risks to the mother's health, such as in cases of severe preeclampsia, heart conditions, or uncontrolled diabetes. Number 3. Fetal abnormalities. If tests reveal that the fetus has severe genetic or physical abnormalities that would make life outside the womb impossible or very difficult, some may choose to end the pregnancy. Number 4. Pregnancy complications. Issues such as an ectopic pregnancy, where the embryo implants outside the uterus, or placental problems can make it medically necessary to end the pregnancy. Number 5. Pregnancies from rape or incest. Women who become pregnant as a result of rape or incest may seek an abortion as a way to cope with the traumatic experience. Types of abortion. First of all, it is essential to note that abortion can be both spontaneous and induced. A spontaneous abortion, more commonly known as a miscarriage, happens naturally when a pregnancy ends on its own, usually before the 20th week. Miscarriages are surprisingly common, with around 10 to 20% of known pregnancies ending this way. Induced abortion, on the other hand, is when the termination of pregnancy is intentionally performed. There are 2 main types of induced abortion: medical abortion and surgical abortion. Number 1. Medical abortion. Medical abortion involves taking medications to end the pregnancy. It is typically an option in the early stages of pregnancy, usually up to 10 weeks. The procedure involves taking a combination of 2 medications, mifepristone and misoprostol. Mifepristone works by blocking the hormone progesterone, which is necessary for the pregnancy to continue. Without progesterone, the lining of the uterus breaks down and the pregnancy cannot sustain itself. Misoprostol, on the other hand, is taken shortly after mifepristone. Misoprostol causes the uterus to contract and expel the pregnancy tissue. Once the second pill is taken, women often experience cramping, heavy bleeding, and the passage of clots. This is expected and indicates that the abortion is taking place. In most cases, the process is completed within 4 to 6 hours of taking misoprostol, though cramping and bleeding may continue for several days to a week. Medical abortions are highly effective, with a success rate of about 95 to 98% when done early in pregnancy. Many women prefer this method because it feels less invasive than surgery and can be done at home after receiving the medication from a healthcare provider. However, medical abortion is not an option for everyone, particularly if the pregnancy is further along or if there are certain medical conditions present. Number 2. Surgical abortion. Surgical abortion is used for pregnancies that are beyond the early stages or when medical abortion is not possible. There are a few different methods of surgical abortion, depending on how far along the pregnancy is. Number 1. Vacuum aspiration. Vacuum aspiration is the most common form of surgical abortion and is typically performed up to 14 to 16 weeks of pregnancy. The procedure is quick, usually taking about 10 to 15 minutes, and is generally done in a clinic or hospital setting. It requires minimal anesthesia, often local or light sedation. The process involves the following steps. Number 1. Cervical dilation. The cervix, which is the opening to the uterus, needs to be gently opened to allow the passage of surgical instruments. This is usually done using dilating rods or medication, allowing access to the pregnancy tissue. Number 2. Suction device. A small, hollow tube, called cannula, is inserted into the uterus through the cervix. A manual or electric suction device attached to the tube is then used to remove the pregnancy tissue from the uterus. Number 3. Uterine scraping. Sometimes a small instrument called a curette is used to gently scrape the walls of the uterus to ensure that all the pregnancy tissue has been removed. Recovery from vacuum aspiration is usually quick, with most women resuming normal activities within a day or two. You just may need to stay in the clinic for a few hours. Some may also experience cramping and light bleeding for a few days after the procedure. Number 2. Dilation and evacuation, D&E. Dilation and evacuation is typically used for abortions after 16 weeks of pregnancy. This procedure is a bit more involved than vacuum aspiration due to the advanced stage of the pregnancy. It usually takes longer, around 30 minutes, and requires more preparation. General anesthesia or stronger sedation is often used to ensure comfort during the procedure. Here's how the procedure works. Number 1. Cervical preparation. In the days leading up to the procedure, the cervix needs to be softened and dilated, often with medication or osmotic dilators, which are small sticks that absorb moisture and gradually expand to open the cervix. Number 2. Removal of pregnancy tissue. Once the cervix is adequately dilated, surgical instruments are used to remove the fetus and pregnancy tissue from the uterus. Forceps may be used to extract larger tissue, while suction is applied to clear the remaining material. Number 3. Uterine scraping, if needed. Similar to vacuum aspiration, a curette may be used to ensure that the uterine lining is thoroughly cleaned. Because D&E is typically performed later in pregnancy, the risks are slightly higher compared to earlier abortions. However, it remains a safe procedure when performed by an experienced medical professional. Abortion aftercare and recovery. After any type of abortion, follow-up care is important to ensure full recovery and prevent complications. This may involve monitoring for infection, managing pain, and ensuring that the abortion was complete. The medical risks associated with abortion are minimal, especially when the procedure is performed by a qualified healthcare provider. Early-stage abortions, whether medical or surgical, have a very low risk of complications. The most common risks include infection, heavy bleeding, or injury to the uterus, but these are rare. It's also important to note that having an abortion does not affect future fertility. Women who have had an abortion can still become pregnant in the future if they choose to do so. That said, the emotional and psychological effects of abortion can vary. While many women feel relief after the procedure, some may experience feelings of sadness, guilt, or regret. It's crucial to have a strong support system, whether that includes friends, family, or mental health professionals, to help process these emotions. Post-abortion counseling is available for those who may need it, and many clinics offer resources to help individuals navigate their feelings after the procedure. Legal aspects of abortion. Abortion is regulated differently across the world. In some countries, abortion is legal and widely accessible with few restrictions. In others, it is heavily restricted or even completely banned. In the United States, abortion was legal nationwide from 1973 until 2022, when the Supreme Court overturned Roe v. Wade, which is the landmark decision that had established the right to abortion. Now, individual states have the power to set their own laws regarding abortion, leading to a patchwork of regulations across the country. Some states have implemented strict bans or limitations, like Texas and Louisiana, while others continue to protect abortion access, like Washington and California. At the end, remember that this overview provides general information. Laws, practices, and available services can vary significantly by location and may change over time. Always seek up-to-date, local information when needed. Now, we want to hear from you. What do you think about the current laws around abortion in your country? Would you like to see any changes? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.